Well, basically being a medtech and studying as an MLT, it's the first step into the healthcare field. So if you're people-oriented, you love people, you love patients, this is a field for you. It's a very good career, it pays very good, it's studying into the healthcare field, and you're guaranteed a job everywhere you go in the world. You can go to and some people just take this as a spring-off position where they go into medical school if they want. So you become a doctor and you also have medtech experience, which is really good. And some people go into research if they want to. They can do PhD if they want to. So it's a place where you can advance and go in different directions, or you can stay here and be in a leadership position and be a manager, which is also part of this program as well.
Well, because we don't have a university hospital, we rely on our community hospitals. And our affiliates are just great at partnering with us, providing clinical training for our students. We have students that go through Queens Medical Center. We have them go to Kaiser, Hawaii Pacific Health, which consists of Kapiolani, Straub, Palimomi, and Wilcox on Kauai. Not to forget our biggest employers of laboratory professionals, DLS, Diagnostic Laboratory, and Clinical Laboratories of Hawaii.
We have a two-pronged system here. We have students coming from KCC who are already MLTs and they're already licensed and they can work in our laboratories right now. And then we have a second group of students that come from biology, they could be chemistry majors, so it's a second degree approach.
For this program, I'm actually working on the second degree route. I'm working on my first bachelor's degree in molecular biosciences and biotechnology, and I want to further my education and enhance my skills in the laboratory, and I found medical technology through UH Manoa as well, and I thought that this program would help me establish my skills in the lab.
I was referred by a couple of co-workers at Kaiser Permanente. There's a lot of hands-on training. It's more like one-on-one contact with the instructor.
For the students who are trying to get into this program, we have a website. It's medtech.jabsom.hawaii.edu. Once you get into our website, you're going to find information about advising, how we advise students into this program, the admission process that we do to get students in here. If you want to donate to our program to help us grow this program and continue to keep going, you can find that information there. Information about our mission and our vision, how we want to be the top academic and technologically advanced center in the world, pretty much. So information is all in there. And our phone numbers are all attached. So go to that website and everything is in there for you.
KCC offered me clinical rotations, and one of the rotations that I did was for the chemistry bench at Adventist Health Castle, and they really saw that I enjoyed my time there and then offered me the position there, and I was able to be an MLT while I finished my clinical rotations at other hospitals, just to again observe what other hospitals, other labs do. And then I found my way back to Castle after I obtained my license in medical lab technician. So they allowed me to be able to continue my education at UH Manoa and also just work the shifts that would help accommodate my school schedule. They were really...
The KCC program, as Christine emphasized, is very competitive because you have to apply to get in, and then when you do your rotations, you get to see what is the expectation of the job, and then you also wanted to further your education. So you go to Manoa, and then you just like reviewing at school and then applying it at the job. So the medtech program is very applicable to your profession, so it wasn't that hard to study, but it's highly competitive. But if you're passionate about it, anything's possible.